Alright, hi everyone. Let us see this Retina Part 2 quiz. And as usual, I will do the quiz like I am giving the test. So I am ready to give this test of Retina Part 2. Let us start with the first question. The first question is a 14-year-old boy present to eye clinic with poor vision in both eyes. On examination, anterior segment was normal. Fundoscopy means retina was checked and the doctor could not find any abnormalities. Still, the visual acuity was less, 6/24 in both eyes. The clinching point is dark choroid on angiography is seen in which condition? It is a retina condition because the anterior segment is normal, but symptoms are more and signs. Symptoms are more than signs because doctor cannot see any abnormalities. While angiography revealed a dark choroid, this is a classical of retinal pigment epithelium dystrophy known as Stargardt's disease. Symptoms are more, signs are less. That's why doctor could not find any abnormalities. RP layer is involved, true. There is no drusen's deposit that is seen in age-related macular degeneration. That's the answer. Autofluorescence because lipofuscin is deposited in RP layer scattered all over the retina known as flecks. Electrooculogram can be decreased in later stages. Yes, because RP layer is involved. Early stages, the electroretinogram affecting the rods and cones and bipolar is normal. Even in early stages, EOG is normal. But later stages EOG is decreased in Stargardt's. But drusen's are not seen, that is seen in age-related macular degeneration. Now this is the left black and white picture means it is a left angiography. Why? Because dye is seen in the retina vessels and the optic disc. This is a retina vessel which is hyperfluorescent because it has the dye. The dye cannot come out because of the inner blood-retinal barrier. And this is dark, this is hypofluorescence, but it is behind the vessel. So it is subretinal vessels. So white area is hyper, green is hypo, green is subretinal. So these three are true, means this has to be false. Even if you don't know which stage of angiography, it is not required. In choroidal phase, retina vessels don't have the dye. Only the choroidal vessels have the dye, and that is first phase of angiography. So answer is, this is not a choroidal phase actually, because the retina vessels have the dye. This is subretinal hemorrhage. Any hemorrhage, any exudate will be hypofluorescence on angiography. So nyctalopia means night blindness. Nyctal is a Greek goddess of night. Hamar is a Greek goddess of sun. That's why hamarlopia, day blindness, nyctalopia, night blindness can be seen in high myopia. Yes, because in that some photoreceptors are not working because retina is degenerated already. So rods and cones are not working well. So there can be night blindness. A Gucci disease is a congenital stationary night blindness in which there is a museo phenomena, that is delayed dark adaptation in a Gucci disease. Xerophthalmia, you should know, it is one of the most important causes of night blindness, that is vitamin A deficiency. But as the name suggests, proton means red, anopia means blindness, that is color blindness, not night blindness. Now this is optical coherence tomography. This is the last layer, that is retinal pigment epithelium, and the neurosensory retina is separated from the retinal pigment epithelium. This is central retinal detachment. Why central? Because OCT can only tell you about central retina. This is subretinal space. This is central retinal detachment, not the total detachment. It is not cystoid macular edema. This is classically can be seen in central serous retinopathy, in which there is an outer barrier break, which is made up of RPE layer and Brooks, in which more fluid is coming from choroid into the subretinal space. That is a central exudative retinal detachment, central serous retinopathy. In a young male, type A personality, under stress, coming to you with metamorphosia. Now this is a left fundus picture showing edema everywhere in the retina but not in the center. This is cherry red spot. Child was brought with cherry red spot, which is seen. Mental retardation, skeletal muscle weakness means it is not an ocular condition. So A option and D option are ruled out. They are differentials of cherry red spot because ganglionic layer edema is there, but there is no history of arrhythmias pointing or rheumatic heart disease pointing towards CRO or history of blunt trauma pointing towards Berlin edema. And Hunter disease does not have cherry red spot. So only answer is Niemann-Pick. Now Niemann-Pick and Tay-Sachs have the same profile. Only hepatosplenomegaly can differentiate. Here Tay-Sachs is not in the option, so directly answer is Niemann-Pick. But if Tay-Sachs is the answer. Then they should have given hepatosplenomegaly is seen in Niemann-Pick, not seen in Tay-Sachs. Now, bilateral optic disc edema with exudates pumping in the macula seen in fundus. It is a macular star appearance in the fourth stage of hypertension retinopathy, that is malignant hypertension, acute BP crisis, where the heart exudates pump in the macular star appearance due to outer plexiform layer, like a macular star in both eyes. Due to high CSF pressure, there is bilateral disc edema and pumping of the heart exudates. So you have to check the blood pressure first because it can be hypertension retinopathy. And the only thing you can do is control the blood pressure. Now, if you're talking microaneurysms that is seen in very mild NPDR, of course, they will be seen in moderate and severe NPDR also. It's the early stage. Internal hemorrhage is seen in mild to moderate. Soft exudate is seen, but IRMA suggests it's a severe or very severe NPDR or PDR. IRMA is not included in mild to moderate NPDR. And you should know the 4-to-1 rule of diabetic retinopathy given by ETDRS. Now, blind spot is there in the temporal visual field and it is due to optic disc because optic disc is nasal in the retina. So, blind spot is not optic disc, it is due to optic disc. So, whenever the optic disc margins are blurred like an optic neuritis, like papilledema, which has bilateral disc edema, peripapillary atrophy like in high myopia, posterior cephaloma, peripapillar myelinated nerve fibers because the myelination is stopping at lamina cribrosa, all can lead to blind spot, but glaucoma, there is theoretically bearing of blind spot, not involving the blind spot, is an early visual field change in glaucoma. So glaucoma does not have enlarged blind spot. That's the 8 questions. I hope you have done well. I know you have done well. I've seen the results. Good. Best wishes.